Hi guys, I'm Dr. Patel and I'm here at Sports Chiro in rehab. Now with the coronavirus, a lot of people have been getting low back pain. I know myself personally, I feel my back is weakening. I've been sitting a lot, so today I just want to show you guys an exercise that you guys can do at home to help ease any low back pain or even prevent yourself from low back pain. I know a lot of you athletes out there, the gyms are closed, so it's hard to stay or feel that you're being as active as you'd like to. So this is the bridge, and we're just going to start by firing the glutes, firing the lumbar spine muscles, because when you're sitting all day, you're kind of in this flex position where everything, the abs and the hip flexors, that all just becomes really tight, and it kind of overstrains or shuts off these muscles in the back. Keep in mind, sitting is one of the most provoking positions for a herniated disc. So for this modification, pick a pelvic tilt degree where you are most comfortable. So this you can do, I prefer not to do it on the bed, but you can do it on the floor, you can do it on any, if you have a massage table, but preferably on the floor with the yoga mat. So with this, the most important thing is naturally when we're lying, we want to have a little bit of a curve in our back. So like as you can see, I can stick my hands right underneath my spine, but you want to have a neutral spine. So start by tilting your pelvis upward and think about pushing each vertebrae bone by bone down onto the table. And now after you hold that position, you're going to dig your heels down and squeeze your glutes. And then raise up, holding here for about 10 seconds. Now, one of the keys is making sure your feet are nicely aligned with your hips. And then when you go back down, it's easy to go back into that arch position. So each time before you raise, just make sure you're engaging your abs, tilting with your hips, and then going up. And then, so this is an exercise, it's not yoga, so you don't need to be hyperextending your back. And that is the bridge. You can do this if you're starting to experience low back pain or if you already have chronic low back pain. This is a great exercise. This is a lumbar stability exercise designed to help the multifidi muscles. Now these are bare bones, but the multifidi muscles are going to run from the transverse processes to the spinous process. Sorry, the spinous process to the vertebrae below. So it's going to run from here to here. And now these are rotational muscles, so you want them to be nice and strong. So this is a good exercise if you've ever been diagnosed with SI joint dysfunction or sacroiliac joint pain. This is also a really good exercise if you play sports like tennis, baseball, even golf, because there's a lot of rotation. So if even you're in the gym and you experience pain with motions like twisting, or if you have kids and you're constantly picking them up or playing with them, this is a really good exercise for that. So just find yourself a nice little spot on the floor where you can lay down a yoga mat. This one I think is actually okay to do on the bed unless you have a very soft bed. I'm going to do this on my handy dandy chiropractic table. So this one, almost like what we did in the previous exercises, the bridge and the DEADBUG, we want to start with the spine in a neutral position so you're not overarched. Now the good thing about this exercise is when you raise your feet up, it automatically kind of pushes your spine into the table. So you're in a pretty neutral position. Arms by your side, and then keep your knees together for this one. I know for the bridge and DEADBUG your knees were apart, so this one you want to keep them together and slowly rotate to the opposite side. So I'm going to my left side, and now I'm starting to feel my shoulder come off the table, and that's where I want to stop. So I want to hold it where I start to feel these muscles engaging, my low back is engaging, making sure that my feet are not by my butt, but I'm holding them up to a 90-degree angle, holding it for about 10 seconds if you can. If you can do 5 seconds, that's fine. And then going to the opposite side. Again, as soon as I feel my left shoulder lift off, I'm going to hold it, I'm going to pause, and then just try to hold that there for 10 seconds where I feel it in my obliques, my transverse muscles, and in my multifidi and my low back. So again, with this one, if you start to feel pain in here, just do it with your feet on the table, and you could do it like this, and you're going to be able to go a little bit further until you feel it right in here. And then same thing on the other side. And again, just try to do as many as you can, making sure you're engaging in your core and keeping your back more flat, not an arch. And that is the exercise to strengthen the multifidi of your lumbar spine. This one it's almost like Superman, but if you're sitting a lot, you're not as active as you normally are. Your muscles are going to start to feel weak. Like I know my lower back starts to feel weak, especially from sitting a lot, being in that chronic position. So if you already have a known condition where maybe you've been diagnosed with facet syndrome, or if you look in the mirror and you have a very arched back, then you want to do this with a pillow underneath your stomach. So I'll show you this exercise, but since I'll be face down, it's going to be hard for me to talk about it, but you will be face down. So if you have those two sorts of issues and you want to do this with a pillow underneath your belly button. I don't have those issues, so I'm going to put that pillow to the side. But as you're lying on your stomach, again, this is going to work your low back, your glutes, but this is a functional exercise. So you're going to get opposite arm and leg, kind of like the dead bug. So this is a good way to, this is a good like baby step into those other exercises, especially if you already have chronic pain or acute pain. So you're going to lie on your stomach. Normally I would relax my neck and my head all the way. So this one's pretty easy. There's really not much to it. You're just firing your functional chains. So right arm, left leg goes up. The only thing is making sure that your toes are pointed down and not across. This is to help you engage more of the glute and not so much the hamstring and the calf. And with this, hold it for about 2 to 3 seconds. You don't really need to hold it for too long. And then just keep alternating. So this one I like because you don't really, it's not putting too much strain on your back, but you will feel it in your back and in your core. And that is the opposite arm and leg exercise for your low back. Even if you don't have pain, this is a great neurofunctional exercise. So it's called dead bug. You're gonna move opposite arms and you're gonna engage with your abs. So I'm gonna have Jessica move the camera around and show you a little bit of what I'm doing. And so just like the bridge, you're gonna start with a little bit of a pelvic tilt. And this one is a little more advanced, so if you feel like you're not able to hold this position or if you start to get pinching in the hips, you can do it with your feet down and alternate. But on a normal or advanced level, I'm going to start with my feet up, and again making sure that my knees and my feet are aligned with my hips, and then just engaging the abs like how I said with the bridge, so making sure I'm not arched, but nice and neutral in this position, feeling the vertebrae of my spine on the table, and then holding that position as I extend opposite arm and leg. And with this, you want to be nice and slow. So you want to be slow and steady, feeling the abs shake as you extend. So right when I get to here, feel it shaking a little bit. And you don't want to just drop that leg all the way down onto the table. You want to be able to hold it. So again, trying to do as many as you can with your abs engaged here, not letting off. So you don't want to let off. You want to keep it engaged here, and then extend, and just do as many as you can. And that's it. That's the dead bug.